You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. According to my first guest, you could get a fixed set of teeth, a full arch of teeth, in just a few appointments. We're talking about dental implants, how they're changing dentistry. With us, we have an expert on the topic, Dr. Stucky. Dr. Stucky, welcome to the program.
Thank you for having me, Randy.
Now, before we get into today's topic, for people that don't know you, I guess you've been in Colorado for about 18 years. Who's your typical patient, and what are the different things you do? Because we're here to talk about dental implants, but you do more than that.
Well, Randy, we're family practice dentistry. We're in a small town in western Colorado, and so we see patients all the way from pre-kindergarten all the way up to 90 years old and beyond. And so there's not really a typical patient. We do everything from maintaining healthy smiles all the way to taking care of toothaches. And what we see a lot of also are denture patients. And to back up just a little bit, I started with same-day affordable dentures. This was many years ago, but over several years, we did several thousand affordable same-day dentures.
You were the denture king.
I was the denture king. That's true.
All right.
And the lowly same-day affordable denture. It's not glamorous, but what it taught me is it taught me a lot about where the teeth go, where to position the teeth to make it look right. But now what we have is there is a much better way to go, and that is you can get dentures to look real. You can get them to look real, but you can't get them to function real, like real healthy teeth.
You mean like biting?
Yes,
okay.
Biting, chewing. The chewing forces go down tenfold from normal healthy teeth to becoming a denture wear. Now, people are very adaptable, and so they forget where they originally were when they were healthy and young and really functional. And so the nice thing about dental implants is you can take those denture wearers, and by adding 2, 4, 6 implants, you can really secure that denture and make it just like real teeth again.
Is that right? So knowing what you know now, like how many years did you make these, fast dentures? What would you call them something?
Same-day affordable dentures.
Okay. So knowing what you know now,
right?
'Cause you're really into dental implants now.
Right.
Okay. Is it hard for you to kind of give people great advice on to do a denture? I mean, do you always try to say, hey, listen?
There's a better way?
Yeah.
Absolutely.
Every time.
Absolutely, because through the years, I've seen people with their struggles with dentures. And even though they're adaptable, they're not really...
Do people struggle with them?
Oh, absolutely.
I mean, I know a few denture wearers. I never hear them complain.
And, well, they may not complain to you because you're not a dentist, but I hear it every day. And so there's a better way. There's a way that you can secure that set of teeth and make it just like the chewing forces go back up to where you were when you had your own real healthy set of teeth.
How old can you be, though? Do this.
I have done implants on a patient as young as 14, and I've done implants on. There was a woman she was 92 years old, and she had come in with her loose, insecure denture, complaining of sore spots because it skates around, and I had talked to her for 5 years about we can help you with some implants. And she would always say, what would she say? She would always say, Randy, if I were younger, I would do it. I hear that all the time too. Anyway, when she was 92, she finally let us put in a couple of implants. She lived another 5 years. She finally passed away at 97.
What do those 2 implants do? Like secure? You mean secure a...
Yeah, secure a lower denture. Secures it in 2 dimensions. Now, if you want to secure it in 3 dimensions so it doesn't move at all, so it's part of your jawbone, then you need four implants. So, but from 92, when we put the implants in, until she passed away at 97, every time I saw her, every 6 months, she would tell me, I wish I had done this years before. So it's never too late. You're never too old.
And they'll stay in the mouth? I mean, it seems like they're going into the bone, right?
Yes, they go into the
It seems
bone.
like they would fall out for a 92-year-old.
No, that the bone is
But
very
painful.
secure.
It's got to be painful because that's is that the thing that holds people back? Because it does sound painful.
It sounds well, it may sound painful, obviously, because I hear that all the time. That's a barrier that people have a hard time getting over. But don't forget, once you get past the skin, once you get into the bone has no nerve endings. The bone doesn't.
Interesting. Okay.
The bone doesn't feel pain. So once you get the gums numb, there's really no pain. In fact, what I hear over and over again for people who have done it is they say, this was so much easier than I expected.
So, good for you. So the patients can be young, up to 93 years old, because going into this, and I don't know if I told you this on the phone, my mother was told at 73 years old by her medical doctor, you're too old for dental implants. And because I told her, I said, I'm interviewing some people, and they're saying that implants are great to secure a denture.
Right?
Do you hear that? Is that a perception there too? I mean, so that comes up all the time.
I hear that all the time.
Oh, not enough bone, actually. Not enough bone for dental implants.
And
Isn't that true, though?
Most people, one way or other, have enough bone. And even if they don't, there are ways around that. There's things we can do for that.
So if it's so good to secure a denture with, why aren't they all doing it?
Well, one reason is a lot of them don't come to the dentist. And maybe they don't come to the dentist because they have a history. The reason they're denture wearers is because they have a history of toothaches and bleeding gums and infections, and they were just glad to get their teeth out. And when they did, they never wanted to see another dentist. and so I may see them once in a while. They may come in every several years for a reline. They may come in every once in a while if their denture is rubbing a sore spot. But generally, they don't come in that much. And so because of that, there's not the opportunity to present the options. Or when they come in, they just want to come in, get that sore spot taken care of, and they want to be out the door. They have such a history of such a negative history with dentistry that
last thing they want to do is see a dentist. I mean, nobody likes going to the dentist, right?
I would say.
Do you hear that still?
I hear
like,
that a
no
lot.
offense, doctor.
Right? Yeah. No offense, doc. It's not you, but I just hate.
After all these years, what's your comeback? Do you have a funny comeback, or you just kind of smile? What do you say to that?
I just roll with it. I don't have any.
But do they end up liking? I mean, are you one of these dentists that feel like that it's going to be challenging, that you know that they're going to end up liking going to your office?
It's a challenge, but I'm up to the challenge. And
Okay.
and I know that if they will go through with it, they will never look back. They will never regret having gone through it.
So no more dentures. You think that might be the future of dentistry, where everything is secured by some sort of dental implant?
I think if we're ever going to get people back to full, complete health and full, complete function, that is the way.
Now, in a perfect world, perfect situation,
Right.
somebody watching this, they go to see you.
Uh-huh.
What's the fastest possible turnaround to get, let's say, even a fixed full arch of teeth?
If they walk in with an existing denture
Mhm.
that's not too worn, that they just want some security and stability, sometimes we can do that same day. You walk
Is that right?
You walk in with this problem denture, this problem situation, and you can walk out a couple hours later with it secured and solid in your mouth.
In all areas of dentistry, because I know you do cosmetic dentistry and a lot of different things, is this the happiest group when you can take a denture wearer and give them a fixed set of teeth again?
This is one of the happiest groups. This is the most profound change.
So elaborate on that when you say profound.
I would say it's a profound change from where they started to where they finish, because no longer do they have to be self-conscious or self-aware of, are their teeth going to stay in place, or are they going to fall out? Are they going to be able to go into a restaurant and finish a meal with their friend at the same time, or if they're going to be struggling through it? Just the confidence that that it instills in somebody in that short period of time is dramatic.
And they're smiling again.
And they're smiling with confidence. They're not holding their hand over their mouth. They're smiling with confidence.
So take me through the process. Okay, a patient goes in on day one. You get some imaging, things like that. What are the frequently asked questions?
The three big ones are, what does it cost? How long is it going to take? And how much is it going to hurt?
Okay.
And we hear that over and over and over again. There are some other, sometimes people will ask the details, but those are the three really big ones. Now, for people who do want some details, we bring out, there's a couple of models here, and like this is a snap in and snap out.
Let me take a look at this. Okay. So this is what it looks like.
Right.
Okay.
That's after the implants are.
So underneath here, there's a little.
Yeah, O-rings, housings, and O-rings.
And just.
Yeah.
Interesting.
And they pop them in and they pop them out to clean them. And
so no more adhesive if they do that.
Right, and that's a big one because people hate adhesive. The commercial makes it sound good, but people do not like adhesive.
Commercial does make it sound pretty good.
It tastes bad, and not only that, it's very hard on the tissue over a long period of time. So this is like one step up, and it's a big step up from just a conventional denture. But this is one step up.
It's like those look like four little implants on the bottom.
Mm-hmm.
And then just snap a full arch of teeth over them.
Right. And you can do it with 4 small diameter or mini implants, or if they have enough bone, you can just put 2 more traditional implants to do the same thing. But still, snaps in, snaps out. So that's one big jump up. Then if you really want full security, stability, teeth that stay in your mouth, they never come out. You brush them and water pick them just like your own. They are a part of you. Then you go one step higher, and that's putting in a series of implants that you connect with a bar, and then you attach the teeth onto the bar, and you screw the bar into place. That's permanent. The patient cannot take it out. The only person who can take that out is the dentist.
Well, it seems like that's what everybody would want, though. I mean, you don't have to take them out.
Right.
Can you eat whatever you want?
You can eat
you
whatever.
Be careful.
No, you don't have to be careful at all. And the beauty of this is it's permanent. It's part of them. It's like real teeth. But let's say that they bit wrong on something, bit wrong on an olive seed or something that was in their salad, and they broke a tooth. All I have to do is unscrew it, take it off, send it to the lab, do the repair, and it's back in their mouth. But Randy, let's talk about eating for a moment.
Okay.
There are so many things that a denture wearer struggles with. A salad, eating an apple. We have a big sweet corn festival in our area. 60,000 ears of corn every year are consumed by the public or whatever. And I've had people who once they can't do that. They have to cut the corn off of the cob. What's the fun in that?
Okay.
So, but with implants, with really secure teeth, I've been told that I can eat corn on the cob. I can bite an apple for the first time in years. They're able to eat chicken and protein. They're able to eat a steak rather than just a ground ham.
Do you ever hear stories of where they come back and say, "I ate my first this, or I ate my first that"?
Oh, all the time. And when we finish, and then 6 weeks later we see them, we ask them the questions. What can you do that you were previously unable to do? And those are the kind of things we hear all the time.
So, even like broccoli or al dente vegetables, they
can do that. Yes.
So it doesn't matter. I mean, they could eat whatever they want.
They can eat whatever they want. And as we as a population, get older and we're trying to maintain our health, think about the difference between a nice, you were talking about broccoli and crisp vegetables that have all their nutrients versus something that's had to be steamed and overcooked for them to consume.
Well, yeah, I mean, as I'm listening to this, I take it for granted because I eat those things and let me think about it.
Right.
And to them, I guess it's a
it's a big thing to them.
Interesting.
It's a big thing for them to try to do it, and it's like
Well, we have a lot of medical doctors on the show, and they're always talking about fiber and digestion and problems. And they always say, Randy, there's no teeth in your stomach, you know, and so you need this fiber. And I guess the denture wearers aren't getting their fiber unless they're taking some sort of a powder or supplement or whatever.
Right, the Metamucil or whatever for fiber. That's very true. You have to be functional in your oral cavity, or nothing else is going to work.
How it's normally done, you go to 2 people.
Right.
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 Okay.
Most of the time, it's done in 2 different offices with two different doctors, but we do it all in
So
my
it's
office.
easier on the patient. But do you think you get better results because of it?
I think there's some distinct advantages to doing it, to me doing the whole thing. In my office, I'm looking at both things at the same time. Where is the best place to put the implant, but then where do I need to put the implant so that when I restore it, the teeth are in their proper position for aesthetics, for function.
Okay. You know, one of the things, and people need to know, it's a real interview. We're talking about no more dentures today. And I'm not trying to side with you, by the way. But based on what you're saying, it sounds pretty good, okay? But the other thing I think I like that I'm picking up on is the fact that, I mean, you made a name for yourself, a big name for yourself with these affordable dentures. Affordable same-day dentures, is that correct?
Yes.
So if somebody goes to you, you're going to give them an option. I mean, correct me if I'm wrong, but you're going to give them an option of an inexpensive denture that's cosmetic, that looks good. And then maybe even a next level up would be some of these small diameter or mini implants. And then, of course, traditional implants. And then a fixed set of teeth. Right. Is that kind of how it may go at your office? Where you're going to give them a lot of options?
I will give them a lot of options because
a lot of guys only do one thing. And I think that people always ask me on my website, you know, because we don't refer people. We'll say, you know, make sure they have experience, you know, look at their work, talk to the doctor, get a feel for them. But I think that if you go to a doctor that does a lot of different things, or at least offers all the technology, it seems like you're going to be in a better position.
That's the great advantage of being a family practice dentist. Is I can offer many different options for the patient, because granted, there are some people who in our area, having their abscessed, painful teeth taken out and having the best set of dentures that you can make put in, and that's a stretch to them economically.
Now, for the sake of time, because we're almost out of time, you brought photos, and these are dramatic photos. So what are we looking at here?
Okay, Randy, I see that every day.
Really?
Yes, and
I never see that. That's not unusual?
Well, you don't see it because the person who has that never smiles. They never show their teeth. They walk around like they're in a bad mood, and maybe they are because they hurt. But just big decay, big gum infections, and all of that.
So this person's in pain in a way? Hurts to chew?
Oh yes, they haven't chewed happily in a long time. The other thing that I see a lot is men will grow a mustache to hide that. A lot of times when we're finished, that mustache that they worn for 20 years, they shave it off. Why? Because now they're confident with their smile. They want to show it off.
Okay.
And so we see that all the time.
So those teeth had to go? What'd you do for
Yeah, those teeth had to go, and he ended up, we put in a snap-in, some implants.
It's all cleaned up, looks good.
Right, that we snapped in over some implants, and he is happy as can be.
You brought a book too.
I did.
Now this goes in your office, this book? This is
Yes, it goes in our front room because we want everybody to see what we can do for them.
Okay.
And just a couple of examples. This right here, and this poor guy, he comes in and his teeth are just badly worn down, and because his teeth are worn down, then the whole lower third of his face collapses. You know, your nose gets closer to your chin, you get wrinkles, you look greatly older than you really are. Okay, Randy, look at the photo on the left. that guy looks really old,
Yes.
very, very collapsed, very, very wrinkled. Just by adding teeth back, you can make a dramatic. It's like an instant facelift. You can take 15 years off of them
Let's take a
just
look.
by giving them teeth. The one on the right
Wow. It doesn't look like the same guy.
doesn't look like the same guy. He doesn't act like the same guy. He doesn't function like the same guy. He's a different character
So his
coming
teeth
in.
had to be removed. You gave him with implants what? Something that snapped in.
I gave him
out?
I gave him six implants and a snap-in set of teeth. And there's another person. Let me show you this one. Now this woman came in. There's her before, and her main complaint is she was constantly having sores in her mouth from a removable partial that was always hurting, and her teeth hurt. The teeth that the partial snapped to were hurting. Mm-hmm. Now look at this after. She's smiling with she's smiling. She's got a beautiful smile.
Compared to the before, it's a different look.
Exactly, and not only that, pain was always an issue for her. Her comment when she left was, "This is the best money I've ever spent."
Do you hear that a lot?
I do hear that a lot.
How important is a smile? I mean, you're a dentist. You probably think it's what? The most important thing?
I think it's one of the most important things. That's what you present to the world with. Either a confident smile that's positive and upbeat and inviting to the world, or if you don't have that, if you're self-conscious, it's a whole different thing.
And we are out of time. But so if somebody's watching this, what do you say to them? Maybe they're still skeptical. They think they're too old. Maybe they think they don't have enough bone, as you mentioned earlier in the program. What do you say to them?
I say you're never too old, and there is always a solution for you.
Different levels of affordability.
Different levels of affordability, and even if it's someone who is okay with their denture, but their denture is worn out, we can make a new one that is beautiful and chews better and is more secure, all the way up through the steps that we've talked about, all the way to something that is a solid, secure part of you.
Okay. You seem like you care, by the way. I mean, I interview a lot of people, right? But I mean, what I'm picking up on is, that sincerely you care about this.
This is the great advantage of being a family practice dentist.
But you do really, because you seem very passionate about this. This is how you get your kicks in a way?
I am. I love this stuff. I like having a lot of different ways to help people, because different people have different needs. Different people have different not expectations, but
different goals.
Different goals. And that's the wonderful thing about being a private practice, a family practice dentist with a lot of options. So I love it, but implants, the things we've been talking about this morning, is the thing that gives the most dramatic improvement
in their life.
Now
you probably have now look, you've been there 18 years and you're in somewhat of a small town. A lot of people know you. Mm-hmm. And because you were the denture guy for a lot of years, what do you say to those people that maybe even you put a great affordable denture for them? What do you say to those specific? Maybe some of your past patients that are wearing a denture.
There's even a better way. There's a great upgrade to what you've had over the last several years.
So no more dentures. You're going to wipe out dentures? I mean, really, if you had your way, no more dentures in Colorado.
In a perfect world, no more dentures. Because this is dramatically better, and it impacts their lives in a very positive way.
What's the best thing a patient ever told you after it was all done?
I think it's the best money I've ever spent. Okay. This has changed my life. It's a wonderful thing when someone gets emotional. They're all finished. They remember the struggles that they've lived through, and when you're all finished and you show them the mirror, and they shed tears and they get emotional, that makes my day. That's good.
That's good. And so consultations in your office, somebody watching this, they can go. Is there a free consultation?
Free consultation for anyone free consultation for any.
Do they get to meet with you?
Yes, they do.
All right. Okay, good, good.
Yeah, they meet our great staff, but they also spend time with me. I'm the guy who.
How soon from the time they walk in your door will you tell them, we can do this for you? Like you're a candidate.
Almost every once in a while, I have to really study things and take more time. 95% of the time, I tell them that day.
That day.
And I tell them what it's going to take, how many appointments. I'm also going to let them know what the cost is.
Okay, good. I want to thank you for coming on the show. Interesting, great stuff.
Randy, thank you
Like
for
your
having me.
enthusiasm. So thanks for coming on the show. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, if you just cut the last 5 or 10 minutes, we're going to have it on wellnesshour.com. Just put in Dr. Stucky or Colorado Dental Implants. You'll find them there. For now, wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.